The discussion about the liver is indeed crucial, because having a healthy liver is vital for your overall well-being. Unfortunately, a significant portion of the population has a fatty liver, and many people may not even be aware of this condition until they undergo an ultrasound or CT scan, which can be quite surprising. Understanding the importance of the liver is a primary concern, as well as learning how to reduce fat accumulation within the liver. There's a simple and effective method I'm going to discuss, and I'll also introduce a daily drink that has some promising scientific backing for reducing liver fat. First, I want to emphasize a key point about the liver that often goes overlooked. Many people mistakenly believe that bile is produced by the gallbladder, but in fact, the liver is responsible for creating bile. The gallbladder acts as a storage sac for this bile. Understanding the significance of bile is essential because it sheds light on the liver's critical role. Bile functions as a detergent in your body, and its primary purpose is to aid in the breakdown of fats. Now, let's delve into what this means. Imagine you've just consumed some fat, and it's making its way from the stomach to the small intestine. While the stomach initiates the breakdown process to a certain extent, the gallbladder comes into play by releasing bile to act on the larger fat molecules. The challenge lies in the fact that bile requires assistance to effectively break down fat. It collaborates with the pancreas, which provides an enzyme known as lipase. The term lipid refers to fat, and ase signifies an enzyme. However, for lipase to fulfill its role, it relies on the support of bile. Here's how it works. Bile's primary function is to break down fat into smaller components, thereby increasing the surface area for the enzyme to act upon. This process results in a considerably greater surface area of fat for the enzyme lipase to effectively carry out its function. In simple terms, bile's role is to increase the surface area of fat during the digestion process, ensuring more thorough fat breakdown in the small intestine where it's absorbed. When there's insufficient bile, the enzyme can't perform its job correctly, leading to potential deficiencies in essential vitamins. One crucial vitamin affected is vitamin A. A deficiency in vitamin A can manifest as night blindness, making it challenging to see clearly at night, particularly in adverse weather conditions. Vitamin A also plays a role in supporting the immune system and may help with sinus problems. Another vital vitamin is vitamin E. A lack of vitamin E may manifest in heart-related issues, potentially leading to increased inflammation in the coronary arteries, which can be detected as calcification and higher levels of cholesterol plaque. While being somewhat sarcastic, it's essential to understand that these vitamins serve multiple functions in the body, and deficiencies can have various consequences. Now, let's consider vitamin D. If your body can't absorb vitamin D properly, it becomes a significant issue. Vitamin D is essential for pain management, lowering blood pressure, promoting calcium formation in bones, and aiding in the absorption of calcium in the small intestine. Without sufficient vitamin D, the rate of calcium absorption decreases significantly. With vitamin D, you can absorb about 20 times more calcium than without it. Without vitamin D, you're prone to various calcium-related problems, including bone loss and sleep disturbances. Moving on to vitamin K, we have vitamin K1 and K2. A deficiency in vitamin K1 can lead to easy bruising, increased bleeding, and impaired blood clotting. Vitamin K2 deficiency, on the other hand, results in calcium buildup in arteries and joints. These deficiencies can have several adverse effects on your health and well-being. Additionally, we have other essential fats like omega-3 fatty acids, which play a critical role in keeping inflammation at bay. Without an adequate supply of omega-3 fatty acids, you become vulnerable to various inflammatory conditions including arthritis, heart problems, and even dementia due to their involvement in brain function. It appears that the brain requires a substantial amount of omega-3 fatty acids to function optimally. Furthermore, bile serves the function of eliminating excess cholesterol from your body. For instance, when you embark on a weight loss journey, such as the ketogenic diet, Fat cells release their triglycerides and cholesterol. Triglycerides can be utilized for energy, while cholesterol cannot. Therefore, we rely on bile to help expel the surplus cholesterol. When there's insufficient bile, often due to limited liver capacity, it can lead to the formation of gallstones. Gallstones are the result of highly concentrated cholesterol, as there's not enough bile to emulsify and break it down, resulting in the crystallization of cholesterol. When individuals have gallstones, what they actually need is more bile, not necessarily less cholesterol. It's important to understand that the liver produces bile from cholesterol. This is why the risk of gallstones and other issues significantly increases for those taking statin drugs, which block cholesterol production. Another crucial role of bile salts is to aid in the elimination of toxins from the body. When your body lacks sufficient bile, it becomes more toxic because it can't efficiently remove toxins that are processed by the liver. The liver's primary function isn't to store toxins, but to break them down into harmless particles. When this breakdown process is impaired, and you're taking medications or exposed to various environmental factors, your body becomes more inundated with harmful substances circulating through your bloodstream. Hence, it's vital for the liver to function correctly to maintain overall health. Another symptom of a fatty liver is the enlargement of the liver itself. As it becomes heavier and larger, it may no longer fit comfortably within its cavity on the right side of the body. This can lead to a backup of pressure that extends to the right side of the neck, causing shoulder pain and tension in the right trapezius muscle. It can also result in a feeling of fullness beneath the right rib cage, which is one of the symptoms associated with a fatty liver. Sometimes, people may believe they need to flush out their gallbladder, but what's essential is addressing the excess fat in the liver, which is a different concern. Another critical aspect of the liver's function is its role in converting T4 to T3, which are thyroid hormones. A healthy liver is essential for this conversion process. Without a properly functioning liver, the thyroid hormones may be present, but they can't be activated because they can't undergo conversion. Approximately 80% of the active form of T3, the thyroid hormone, relies on the liver for this conversion. When the liver isn't functioning optimally, the conversion rate may drop, resulting in thyroid issues. Therefore, it's crucial to have a well-functioning liver to maintain thyroid health and prevent thyroid problems. The problem often isn't the thyroid itself, but rather the liver's ability to convert thyroid hormones correctly. This is a crucial distinction to understand. Another vital liver function is its role in buffering excesses of sex hormones, such as estrogen and testosterone. Having too much of either hormone can lead to various issues. When the liver isn't functioning optimally, it cannot produce the necessary proteins to buffer these hormones properly. This can result in conditions like polycystic ovarian syndrome in women, which involves excess androgen, as well as imbalances in estrogen levels. Even in men, liver issues can manifest as problems with breast tissue, low testosterone, and more. Now let's talk about identifying symptoms of low bile. If you experience intolerance when digesting fat leading to bloating, it could indicate a need for more bile. If your stool appears light-colored, pale or gray, floats, or leaves skid marks, it may be a sign of low bile. Feeling unsatisfied after eating could also be due to inadequate fat extraction, suggesting a need for more bile. Nausea, indigestion, bloating, burping, and belching are classic signs of low bile. Understanding these basics about the liver and the importance of bile is crucial. Bile plays a significant role in preventing the accumulation of fat in the liver. Anything you can do to increase bile reserves is beneficial for maintaining a healthy liver. Some people opt for purified bile salts, and I've provided a link below for more information. Today, I'll discuss a straightforward shake that can help reduce fat in your liver. I want to emphasize that being on a ketogenic diet and practicing intermittent fasting together can reduce liver fat by 50% in just 14 days. Seed ingredients for this liver-friendly shake are straightforward. You'll need kale, blueberries, and kefir. I recommend using organic kale and blueberries, and it's best to keep them in the freezer as it makes blending easier and enhances the taste. Here's the process. Take 2 cups of frozen kale. Add 1 cup of frozen blueberries. Both kale and blueberries contain quercetin, a powerful nutrient that combats fatty liver and offers various other health benefits, including immune system support. Pour in a cup of water. Include 1 cup of plain, whole-fat kefir. It's important to choose plain and unsweetened kefir. Look for organic or grass-fed options, if possible, as this will provide the probiotics needed to reduce liver fat. Blend all these ingredients together thoroughly for a couple of minutes. The result is a tasty and highly effective shake for reducing liver fat. You can enjoy this shake daily, and it pairs well with a healthy ketogenic diet and intermittent fasting to further support your liver health.